My name is Sarah Stout, and today I will be discussing opioid addiction during pregnancy. At the end of this video, I hope I have inspired and interested you to advocate change regarding this issue. Some may not be aware how relevant this topic is to today's world. According to the CDC, maternal opioid use disorder rates at delivery more than quadrupled from 1999 to 2014. Opioid use during pregnancy risks the child developing neonatal abstinence syndrome or NAS. According to CDC, data analyzed from 2016 showed approximately one baby is diagnosed with NAS every 19 minutes in the United States. On top of the consequences of NAS, the Mayo Clinic lists other potential consequences, including placental problems, including placental abruption and placental insufficiency, premature rupture of the membranes, preterm labor or premature birth, fetal growth restriction, preeclampsia, miscarriage or fetal death, postpartum heavy bleeding, and inflammation of the fetal membranes, along with potential health risks. According to the Health and Justice Journal, substance use during pregnancy puts the mother at risk for a slew of charges, including child abuse, contributing to the delinquency of a minor, causing the dependency of a child, child neglect, delivery of drugs to a minor, drug possession, child endangerment, assault with a deadly weapon, manslaughter, and homicide. I have inserted the current policy regarding drug screening of pregnant women for Bon Secours Richmond region. It states the indications for urine collection for drug screen include impairment suspicion, no prenatal care, minimal or late prenatal care, an unreferred patient, a patient who has a history of drug abuse, and placental abruption. Pregnant women who are addicted to opioids face barriers to the health care that they need. Women are afraid to seek care because they fear criminal penalties and the risk their child will be taken from them. The CDC warns that stopping opioids during pregnancy is not recommended as it can cause serious consequences, including miscarriage. Instead, they recommend women with opioid use disorder utilize medication-assisted therapy, also known as MAT, because it is associated with better outcomes and reduced risk of relapse. NAS is expected to follow MAT, but usually its effects are less severe and the benefits outweigh the risks. Women who use street drugs instead of medication-assisted therapy run the risk of using tainted drugs. They also may be varying their dosage, which may cause the neonate to go through withdrawal in utero, which can harm placental perfusion. And they run the risk of exposing their infant to bloodborne disease. But access to medicated assisted therapy may be limited. Suboxone can only be prescribed by a Suboxone doctor who's a physician who's completed training and met certification requirements for this privilege. Also, after the first year of gaining the certification, they can only prescribe to 30 patients. The Health and Justice Journal tells the story of Kelly, who sought help to detox at a local hospital but was denied and instead given more opioids and sent home due to fear of liability. Her quote is listed on this slide for you. My plan would start by doing a trial in the Richmond area, then evaluating its effectiveness. I would use the Bon Secours Richmond facilities because they offer a good mix of patients who come from both rural and urban backgrounds, have different races, and different economic groups. I would change the current Bon Secours policy so that all pregnant women are screened for drugs at every visit. This will prevent patients from feeling discriminated against and may find women who may be struggling who may have never been screened. I would advocate Medicaid to give incentives to OBGYNs who gain certification to prescribe Suboxone. This will increase access to those in need. I recommend creating an accreditation program that can acknowledge offices that have an OBGYN who can prescribe Suboxone and an appointed staff member or members who follow these patients' treatment and they can act as a resource to help them stay off the street drugs during their treatment by making appropriate referrals and helping the patient keep up with their appointments. This could be a nurse, case manager, social worker, and anyone qualified. This would communicate a willingness to help these women and may encourage them to seek prenatal care that they need. I hope this video has educated you and inspired you to be a change that these women need. I will end this video with a quote from Gandhi. The true measure of any society can be found in how it treats its most vulnerable members. Let us remember these women are in an extremely vulnerable state and are in need of help. It is help we can give and change we can bring.